What pharmacology basics are essential for medical school? Imagine trying to fix a complex machine without knowing how its parts work. That's what studying drugs in medical school can feel like if you don't understand the basics. Pharmacology is all about how medicines interact with the body and how the body processes these medicines. It's a key part of your first and second year because it builds the foundation for everything else you'll learn about treating patients. First, you need to get a grip on pharmacokinetics. Think of it as what the body does to the drug. It starts with absorption, which is how the drug gets into your bloodstream. Then comes distribution, where the drug spreads through tissues and organs. Next is metabolism, mostly happening in the liver, where the drug gets chemically changed into forms that are easier to eliminate. Finally, excretion is how the drug leaves the body, usually through the kidneys. Knowing these steps helps you figure out how much drug to give and how often. Next is pharmacodynamics, which is about what the drug does to the body. It involves understanding how drugs work at the molecular level. Drugs usually act on specific targets like receptors, enzymes, or ion channels. You need to learn about drug efficacy, which is the maximum effect a drug can produce, and potency, which is how much of the drug is needed to get a certain effect. You'll also study different types of drugs like agonists, which activate receptors, and antagonists, which block them. This helps you understand how drugs can either stimulate or inhibit bodily functions. You'll also need to know about different drug classes. For example, antibiotics fight infections, while antihypertensives lower blood pressure. Each class has common side effects and potential drug interactions. Knowing these helps you prescribe safely and avoid problems. For instance, some drugs can interact with others, making treatments less effective or causing harmful side effects. Patient factors are also important. Age, gender, genetics, body weight, and existing health conditions can all change how a drug works. For example, older adults may need lower doses because their kidneys work less well. Some people have genetic differences that affect how they process drugs, which is called pharmacogenetics. Adjusting doses based on these factors is key to safe prescribing. Understanding adverse drug reactions and toxicity is another must. Some medicines can cause side effects or even poisoning if not used carefully. Knowing how to recognize and manage overdoses is vital. For example, if someone takes too much acetaminophen, they might develop liver damage. You need to know how to treat such situations. Finally, signal transduction pathways explain how drugs trigger responses inside cells. When a drug binds to a receptor, it sets off a chain of events that lead to a change in cell activity. Learning about these pathways helps you understand how drugs produce their effects at a cellular level. In your first and second year, applying these principles means learning to choose the right drug for a disease, adjusting doses for different patients, and predicting possible drug interactions. It's about connecting theory with real-world patient care. Building this solid understanding of pharmacology basics will make you more confident when you start clinical rotations and begin prescribing medicines responsibly.